Okay, Rick, I think we can get started. Thanks for joining us again as we near the end of this particular ECHO series. And I want to thank especially Dr. Ivers-Landis for joining us this morning, who has some specialized behavioral expertise and shares my passion for prevention and treatment of childhood obesity, which I did for many years at Children's Hospital, Pittsburgh. So next slide, please, Rick. A reminder not to use any PHI in your case discussions or otherwise. Next slide. This is the agenda for today. So we have two very interesting cases that I think focus on behavioral issues to a significant extent from Lisa and Kevin. Carolyn and Jim will be presenting this morning, and Chris and Jim will be discussing our cases this morning as the lead discussants. Next slide. Usual reminder about assistance. Next slide, please. And these are our disclosures with no changes from last week. And again, another reminder to use patient-centered language as much as possible as we go through this. Next slide, please. Okay, thank you very much. Jim and Carolyn, please take it away.
Okay, well, good morning and welcome to our presentation today on advances in behavioral interventions. We're very excited to present this to you. I'm pleased to present today with my colleague, Carolyn Ivers-Landis. She's a clinical psychologist and a professor of pediatrics, specializing in weight management for children and adolescents. And she's also an accomplished researcher investigator. She's the lead psychologist in the program Pathways Toward Wellness at Rainbow Babies and Children's Hospital. She uses acceptance and commitment therapy in her work, and she's going to present on that topic today. Following Dr. Ivers-Landis' presentation, I'll present on solution-focused therapy. Next slide. So our learning objectives today are to be able to list and describe these two newer approaches to counseling for health behavior change, being acceptance and commitment therapy and solution-focused therapy, describe their effectiveness and strategies to incorporate these into primary care counseling to prevent cardiovascular disease. So Dr. Ivers-Landis, would you start us off, please?
Yes, hi, thank you everybody, and I'm excited to be here today, and thanks for inviting me. So I'm going to be talking about using the ACT metrics in primary care or in your specialty practices and focusing on healthy lifestyles, and you can also use this for adherence to treatments. Next slide. So ACT is pronounced ACT. It was originally developed by Stephen Hayes, who's a psychologist. And here is one of the latest books, if you're interested in finding out more, which is Hayes and Colleagues, that came out in 2011. Dr. Hayes also has another book that's more about the constructs that are part of ACT. So if you're interested for some light reading, this is what I would recommend. So ACT is a form of cognitive and behavioral therapies that also includes mindfulness. I'll be talking about that. Next slide. I want to also kind of give you some systematic reviews for health behavior change and psychological well-being, and these just came out this year. So ACT has been used successfully for weight management and psychological well-being in those who are overweight or obese, and this is a paper that looks at adults. Or this looks at a review with adults. So if you wanted to look at the systematic review, you can refer here. It also has been found to be efficacious for patients with type 2 diabetes. And I think that's the topic of this whole ECHO also, is some of these metabolic syndromes. So this is another systematic review and meta-analysis that I want to refer you to. It's been used with children as well. These are just some screenshots of the review papers that I'm recommending. And my colleague, David Janicki, who's at the University of Florida, has been using ACT for children who are overweight or obese also, and is doing research in that. And at Rainbow, our program is called Pathways Toward Wellness, and I've been using acceptance and commitment therapy as part of that program. Okay, next slide. So what is ACT? The basic premise of ACT is that people get stuck in their minds. They're really thinking about their thoughts, and they really benefit from some tools And this is what I'm going to try to give you guys today to use in your practices to get out of their head and into their lives. And that's that quote that I think really captures ACT very well. And you can tell that to patients. Maybe that will appeal to them. Okay, next slide. The objective of ACT is psychological flexibility. If you want to say one phrase, that's what I would say to describe it. You are aware of difficult inner experiences, like what are you thinking, what are you feeling, memories you might have. You're noticing those, but opposite of trying to change them, eliminate them, or avoid them, the unpleasant thoughts, feelings, or memories, which is called experiential avoidance. It's really the opposite of that. And if you think of cognitive behavior therapy, you're really thinking about being aware of the thoughts and then like, are these accurate? How can I think of this differently? Things like that. So this is very different than that. So ACT is really about being present for what life brings in every given moment, which is about mindfulness. And you're really moving toward valued behavior. So I'm going to give you guys a one-page sheet, which I have the kid version of it. I'll give you the more adult or neutral version later. Literally one page, which is the matrix, where you can use that, which is a tool to think about and encourage psychological flexibility. Okay, next slide. So this is my kid version, and this is the nutrition version of my slide. And I thank my son for the illustrations. He's now 21 and he's a junior at Ohio State majoring in computer science engineering, but he is also a good artist. So you can see this is the ACT matrix, and this, but for adults, I just have words in here. And I'll talk about the different quadrants, but the picture below just quickly is values, who or what is important. Upper right is toward, you can see toward for the arrow there. And bottom left is negative thoughts and feelings. And then upper left is away behaviors. We're going to talk about those in much more detail. So that's just the matrix, the one page. Okay, go ahead. So talking about that bottom right quadrant, which had the boy with his cat, values, it's really what I think is really helpful about ACT is it's really focusing on values rather than goals. And I think we in psychology and also in medicine, we're always coming up with goals. And there is literature to show that when people set goals, they do better. But this is also about, you're not using the word goal, even though you are obviously setting these behavioral intentions, but you're talking about values. You cannot miss a value or meet a value. You can only be, behaviors can only be moving you toward or away from a value. Goals may be reached or not reached. You might have a patient coming in and you ask them, did you do X, Y, or Z? And they might have negative thoughts and feelings. They might feel shame, guilt, inadequate, or even feel stigmatized if they didn't reach their goals, which might even be a weight goal. Okay, next slide. So moving through the matrix, and I'll have a bunch of pictures of it that'll come up so you can keep it in your mind. So again, the bottom right quadrant, values, which had the boy with the cat. We in psychology for motivational interviewing, which I know has been covered in past echoes, we have a whole values card sort, which I think is like 50 values. It's crazy how many there are. Or there can be a list of values. So you can actually have that, which I don't have to use it in my practice. I just kind of talk about off the top of our heads values. But everyone has different values. And the top ones that we talk about at Pathways Toward Wellness is your family is important to you. It's who or what is important. Your friends are important. Health is important. There might be something important to you about having more energy or being better at a sport, or feeling more awake and alert during the day. Things like that might be values. And for a parent, it might be, helping their child, being a parent that's, supporting their child well. So to know when you're making it toward or away, if you're moving away or toward, you have to know, what are you moving toward or away from? What's important to you? And again, it's not coming from the provider. It's not coming from me, Dr. Ivers-Landis. Oh, I want this kid to be healthier. It's actually, I ask the kid, and I'm often surprised about what values they pick. And sometimes they surprise me positively. Like I had a child the other day that is, actually it was yesterday, that was probably 300 pounds at 5 feet tall. I mean, and he told me he was really interested in football. And that was really important to him. I was shocked. I didn't think he was going to say, because this is like a kid that loves to play video games. Excuse me. So again, it really is helpful to ask people their values, and it doesn't take very long. Okay, next slide. Okay, here's just to remind you, we're talking about them, right? Okay, continue on. Okay, the upper right quadrant is toward move. So what are you doing to move toward? Like, for example, to feel more energetic, maybe you're walking the dog after dinner, or maybe you want to plan to get together with someone on the same day or week. So these are things that they're actually doing now. Maybe you're drinking water, things like that, and things you plan to do. Again, this is kind of like having a goal, but not using that word. Next slide. The lower left quadrant, which had the little monster with the fez on it, is unwanted negative thoughts and feelings. They might get in the way. So you might feel upset, mad, or sad. So you could feel ashamed or guilty. So you might think about physical activity. This is hard. I look stupid exercising. I hate to get sweaty. Other people are better than I am. Other people will judge me. So rather than prejudging the experience, the whole point of ACT is do it anyway. Okay, next slide. Away moves is the upper left quadrant, which was the can of pop. So think about when you are reacting to a negative thought or feeling with some behavior that moves you away from who or what is important. So for example, when you're feeling fatigued, which is a negative feeling, you might stay inside on the couch streaming shows instead of going for a walk. When you're feeling overwhelmed, you might order pizza rather than fixing a healthier dinner. Okay, next slide. So what we want to talk about is choosing a toward move despite these inner experiences. For example, learn to have a choice about the behavior. Like you might have negative thoughts or feelings like, I'm a picky eater, I don't like eating veggies is boring, but you're eating them anyway. So because it might not be that great, but it's consistent with your values. I'll survive it, maybe I'll even learn to like veggies. Okay, next slide. So what I really want to talk with you guys about, and to kind of be finishing this up, is that you can invite your patients just with this one-page handout to use the ACT matrix. Again, the upper half is behaviors, what can be observed with the senses. The lower half is mental or private processes. And then you're going to the right, toward, or to the left, away. So next slide. And here it is again. And I just want to point out, if you look between the monster and the soda can, that's where people get stuck. I think of it on that line. Sometimes I draw a circle, like a spiral circle, like you're having a negative thought and feeling, you're stuck. Maybe you're doing emotional eating, maybe you're just being sedentary, you're stuck there. So instead, draw an arrow toward the broccoli so that you are moving toward who or what is important rather than getting stuck on that line. Next slide. So this is just, a little script I wrote that you can talk about. Hey, I'd like to tell you about a tool I share with my patients. It's called an ACT matrix, acceptance and commitment therapy. Tell them it's cognitive behavioral mindfulness. And next. You're telling them these are 4 quadrants. It can be done really quickly. I just did it yesterday with a patient. Values in the right, toward moves top, negative thoughts and feelings, bottom left, away moves top left corner. Okay. And really the purpose is value-centered living. And then you're talking to them, just telling them, keeping your values in mind, moving toward what's important, being aware of negative thoughts and feelings, and being aware of when you're moving away, you're not judging yourself for that. And then you're just trying to move toward more often. Next one. And then you're just telling them who are what is important, what gets in the way, these things. And this is just it in a nutshell, the key questions. And you just have to think, can you imagine using this and going through this simply with your patients? And I think it might be very useful for you. So thank you very much for your attention and for inviting me.
Great. Okay, thank you, Carolyn. Really interesting, fascinating, and I can see how it could be potentially integrated with some motivational interviewing because it's also a values-based approach to helping patients change health behaviors. Okay, so thank you. I would like to present today and tell you about solution-focused therapy in primary care. So this is a strength-based approach to helping patients identify their competencies, how they're resilient and the previous successes that they may have had in being able to cope and being able to change their health behavior. Doesn't focus a lot on problem identification, so it doesn't spend a lot of time in that area. And I'll explain why that is later. It's been adapted for using in primary care settings, although it's mainly been developed and used in mental health settings. So this is really a fairly recent development, using it in primary care, and that's why I'm presenting it here. But we've been using it and teaching it to our residents for about 12 years, and providers really like this approach. It is compatible with motivational interviewing and other health behavior change methods. You can use the individual skills or you can use the entire model. Next slide. So the crux of it is essentially eliciting effective solutions from the patient rather than trying to anticipate what might work for them. We actually go to them, and the patient is the expert on their own life, and identify what works for them, essentially what's working and how can we help you get more of it. Next slide. So as I mentioned, it's been developed and used for quite a while, and meta-analyses have shown statistically significant effect sizes in medical settings for psychosocial outcomes and health-related behavioral outcomes. Magnitude of these effects is similar to other evidence-based interventions. What's nice too about primary care application of this is that it works at a low intensity as well. So you may not have a lot of time to work with patients during a 15-minute visit. You may have 3 or 4 minutes, and maybe you'll see them again in 3 or 4 months. It can be effective at that level too. Next slide. So it's been applied to many health conditions, psychosocial conditions. Certainly, this is just a sample of those since it's been developed in mental health settings, but now more recently been used for adherence to treatment, weight management, improving diet, diabetes control, increasing physical activity, and other health-related behaviors. Next slide. So one of the core assumptions is that change is occurring all the time. So in any living biological or behavioral system may have equilibrium, but there's also variability. There's also change. So this approach kind of takes advantage of that and identifies those exceptions. Also assumes that small changes can lead to big changes. So we don't need to ask patients to take on a great amount of change to begin. They can begin with very small changes. And we don't need to know a great deal about the problem, just enough to begin to identify solutions with the patient. So that helps save time as well and keeps the focus on what's working rather than what isn't working. And it assumes that patients have strengths and resources that can help them drive change. And it generates optimism and hope on the part of both the patient and the provider as well. Next slide. So there are 6 components to solution-focused therapy, and those that have asterisks I'll cover in this presentation. The other 2 skills, in the interest of time, I won't cover, but they're similar to motivational interviewing skills, so you may already know how to do these skills. Next slide. So the miracle question is a core question in this method. And what we're doing is helping the patient identify workable solutions by looking into a hypothetical future. It's a bit of a different and unusual question, so we often will prepare the patient for that by just simply saying, I would like to ask you a question. It's a little bit different from those you might have heard before, and it will require you to do a little bit of pretending. Is that okay? Once you have permission from the patient, you can say, so imagine while you're asleep tonight, a miracle happens, and tomorrow, when you wake up, you are on track to getting your blood pressure to consistently stay in the healthy range. So tomorrow, what would you be doing differently if this miracle occurred? Can you walk me through the day? What would others notice is different? So what we're doing is we're putting the patient in the position of having essentially solved much of that problem that they're coming in to talk with you about. They're on track to getting there. These are behaviors that they're often implementing in a very small way already. And so what we want to do is help them identify that and amplify that, or they may be new solutions. And these are solutions that work in the context of their own life, in their own home life, their family life, their work life, and in context of their own personality. These are solutions that we really can't know about. So we put this kind of in the ball in the patient's court to identify these things and tell us about them. And a simpler way to ask this question is, let's pretend for a minute that you're on track to keeping your blood pressure in the healthy range. What are you doing differently? And if they can't identify anything, patients can usually identify something very small. So what's the smallest thing that you would be doing differently? And small changes can lead to big changes. So we then will help translate that for the patient to an action step if they're ready to take that. Next slide. This is a skill that a lot of people start with when they're using motivational interviewing because it's very accessible, but it's very effective too. So what we're doing here is we're looking to the past and really to the present for solutions to whatever the target behavior is that we're trying to help the patient change. So think about days when you take your blood pressure. What do you suppose is different about those days? The patient might tell us that the blood pressure cuff, they leave it on the table, their kitchen table. They may get up earlier that day. We don't know, but the patient knows, and the patient can tell us about that, and then we can help them devise ways to make that happen more often. Next slide. Coping questions are also very effective, particularly when patients are feeling overwhelmed, or even if they're feeling overwhelmed just by the prospect of changing their behavior at all. But these are useful questions for a patient who's feeling overwhelmed for any particular reason in your exam room. Next slide. So some examples of this are, that sounds nearly overwhelming. How are you able to manage this? How are you preventing things from getting worse? So even in the bleakest of circumstances, patient can identify coping skills, things that they're doing, strengths that they have that they are probably not aware of. So we want to identify that and essentially give them credit for that too, and help build their confidence and their sense of their ability to be effective moving forward. One of the skills that we use, one of the ways that we use a coping question in our weight management clinic for patients who come back after a few months and perhaps they haven't lost any weight, they're feeling disappointed, and they're feeling perhaps a little embarrassed. They say, I see that you haven't gained weight since I last saw you, and that's a victory too. So what did you do to prevent that weight gain? Because for patients who are prone to gain weight, just simply preventing weight gain involves the same skills really that are involved in losing weight, except that they would do them to probably a greater extent, more frequently, more intensively for weight loss. So those skills are already present, and we can help them identify those things. Next slide. So this gets to action steps for the patient. In solution-focused therapy, they're called tasks, which I don't really care for that term. But for patients who are ready to take action, you can identify specific action steps or tasks. These would be exceptions or parts of the miracle that took place when they're on track to solving their problem. For those who aren't ready to take action or that you haven't had a chance to really go in depth with, you can ask them to just observe and notice those exceptions. What's different when you do these things? Let's talk about it next time. Next slide. So one example would be, say, based on your idea about using alerts on your phone, would you be up for a little experiment? You can use the word experiment if you think that might be something that would appeal to the patient. If not, you can just simply say, would you be interested in trying something? What do you think about setting a phone alert that reminds you to take your blood pressure every day? So this was the patient's idea that came up. And see what effect it has and how often you take it. over the course of a week. So using this solution that came from the solution-focused discussion earlier about blood pressure, you can put this out there as a task the patient might be able to work on. And this is negotiable, of course. The patient can come back and you can negotiate that and come up with something that they can work on, gather a little bit of data, learn about the solution, and come back and tell you about it. And you can end this with saying, I'll be really interested to know, what you find out when we see you again. Next slide. This model also has been shown to have some positive effects on clinicians. It appropriately shifts this burden of identifying solutions from you, the clinician, to the patient, who's the expert on their own life. And it emphasizes strengths, and that creates an atmosphere of empowerment in the clinical encounter. And it fosters resilience and optimism on both parts, clinician and patient, and can protect against burnout. Next slide. So if you want to begin to learn more about this and how to apply this, I would recommend this article. It's a basically instructional article for how to apply it in primary care. And you can obtain this free via PubMed by simply putting this citation for the article in the search box in PubMed, and then it will return the abstract, but next to that will be a button that says free full text. Click on that and you can get the PDF. Next slide. That reference is here at the top as well, and here are a couple other learning resources. Next slide. These are the references for the conditions for which it's been used in case you're interested in exploring any of those specific conditions. Next slide. Okay, thank you. I'll turn it back over to you, Bill.
Thanks, Jim. Thanks, Carolyn. Any questions for either of them about these approaches, which I think that the valuable thing is they've given us some tips on how to incorporate these into our routine encounters. So that's probably the most valuable message we've got. Any questions at all? So thank you all. And I'm going to turn things back to Claire for a moment.
So we send out one big exit survey that'll match the pre-clinic one that you did in August, September. You will get a couple of reminders if you don't fill it out, so please fill it out. It shouldn't take too long. A post-clinic survey for today has already been emailed to you. That should take about a minute to complete for feedback for our speakers. And then in terms of CME, so you do get CME if you would like to claim it for participating in every week that you do, you get an hour. Kathy Sullivan is for Metro. She's the one who handles our CME for cardio. So she is filling out that paperwork tomorrow. So you should get an email from myevaluations.com is who does our CME either tomorrow, Monday, or Tuesday. It depends on when they process it. If by the end of next week you haven't received anything, go ahead and let me know and I can try and track it down for you. But thank you all for everything, and
thank you, Claire. Happy holidays to everyone.
Happy holidays.
And hopefully we'll see you in the new year again.